That was
Yeah, it's good.
sweet. Cool.
It's better than it's definitely better than last week.
Yeah, perfect.
All right, we're on. So,
everyone.
Flow Nose number 2, Craig.
Good morning.
Success of last week.
Yeah,
I haven't checked the numbers yet, but I think there was probably 2, maybe 3 people watch. Good. 1 subscriber.
Yeah, sounds good.
So what do we talk about this week, Craig?
So we thought we'd talk about something that we both hold, I suppose, pretty closely in regards to with what we implement ourselves, but then also something that we try to get our patients to take on board is strength training and the kind of numerous benefits of it, I should say. We already know that strength training can have performance benefits, but it can actually have pretty significant injury reduction benefits also, and then also benefits for quality of life as well. So there's a few studies we'll touch on today, I think.
Definitely. I mean, even if we just kind of look at the world, like the physical activity guidelines, you kind of look at the strength training as a part of that. And often when we ask people in our consults and things, we've got a little section in our initial interview or consultation where it's like, are you meeting the physical activity guidelines? And a lot of the time people might be active and getting some low level aerobic training. A lot of them miss out on the strength training kind of side, and therefore they miss out on a lot of the strength training benefits, which we see is improved function, improved musculoskeletal health, and particularly for like certain populations, I think, and not just our sports people, but definitely for our elderly population and particularly our female population as well. There's so many benefits as they progress through life to get into a regular strength training routine. So we've got a paper, don't we, today? Or
yeah, there's a little paper that we can kind of touch on a little bit. So it was published in 2018 in the British Journal of Sports Med, which is a pretty renowned medical journal. Pretty good quality evidence there usually. So it was a meta-analysis. Essentially what that is, they get a number of randomized controlled trials. So basically trials where variables are as controlled as they can. They test one intervention and then see the effect of it while trying to minimize for the impact of other variables as best they can. What the meta-analysis does, it then combines a number of these randomized controlled trials together to almost try to get the average effect of things, I suppose, in simple terms. So this one combined 6 studies. It had a total of, I think, a bit over 7,000 participants, 7,739 to be exact, and they ranged from about 12 to 40. Essentially, it looked at the strengthening intervention and its effect on injury risk. So some pretty positive results with it. So they found that strength training programs as a whole reduced the likelihood of injury by 66%. And they also found that with 95% certainty. The other interesting things that came out of it were the longer the program, the more favorable the results. So essentially consistency over time provides the greatest results. And that's probably something we see clinically as well. Like we see the people who really kind of get in a good routine, stick to it, gradually progress things are the ones who really get the benefits of, I suppose, the outcomes that they're after. Where sometimes you see like people doing like a yo-yo or kind of getting on a bit of a roller coaster where they'll kind of really go hard for 3-4 weeks and then they drop off and then they spike and then they're down. And they're the ones that sometimes encounter a few more troubles than the people who just take that consistent approach, build habits over time.
Yeah, it's one of those things where we talk about a lot, especially in our sports population, is kind of the Tim Gabbett work, the kind of acute to chronic workload sort of stuff. And I think what you see is the people that are consistent over time, and I've got a few clients in mind that they're older kind of clients that have been doing things for a long time, and they're just in that habit where they might be kind of running a couple of times a week and then doing a couple of body weight or strength-based sessions in the gym. And they're really fit and healthy. And I think if you looked at them from a biological age point of view, they'd be really quite healthy in a sense that they're mismatched for their chronological age. But we talk about the chronic workload as your kind of fitness. And if you can be consistent over time, you can build the body to be so much more robust, and it can tolerate more, it can take more volume of kind of work. But what we often find, it's that kind of drop off in doing some intervention of training, and then the comeback or the motivation comes, the new year rolls around, it's after Easter or whatever it is, or COVID hits and it's like, I'm going to start running. That's when we see those spikes in kind of, I guess, workload. And that's where we often see these kind of injuries come on, not traumatic injuries, but probably more insidious, gradual injuries that people present with, just because they kind of don't maintain a kind of consistent approach.
And I think definitely, and I think one of the things in this study was that the programs had an average of 8 months. So essentially it's creating almost like a lifestyle to get a lot of those really nice benefits. So essentially what we're looking for in the early phases of things, as much as anything, with some of our clients in the clinic, it's just creating habits to begin with. So any one particular session isn't really the most important session in the world. It's more when you accumulate a number of those sessions that you're actually getting the results. So that's often what we're looking for to begin with, and sometimes getting that slow start to things and then building things up allows our body to adapt and recover, rather than having those huge spikes in workloads that you're talking about, where sometimes the body just, it becomes too much, and then you start to get these aches and pains, or you might get a bit sick, getting run down and things like that, which cause you to kind of drop off. So it is just like that gradual consistency that really, I suppose, from a clinical perspective, we see it, but then from a research point of view as well, it also seconds that, where you get those benefits.
Well, like I guess if you kind of look at a lot of the stuff that we kind of do in the clinic, a lot of our stuff that we do is just strength based. We work out, our approach to it is to work out where a person's functional level is, where they're having trouble, what they want to get back to in terms of their everyday life. Do they want to get back to kind of just playing with the kids, grandkids, getting back to sport, whatever it is? And kind of what we do, I think, quite well in the clinic is we test them for their current functional like capacity level, whether it's kind of lower limb testing, upper limb testing, or it's total body testing. And we use that baseline data to map out a plan to get them to where they want to be. So a lot of our structure in our rehab is really about getting people to be consistent and apply the strength training principles to get better functional capacity, so that their bodies can be. I keep saying robust because I think there's an element of people thinking that the body's fragile, and I think we touched on it last week as well. But if you're consistent over time, the body can do amazing things and can tolerate quite heavy loads, but you've got to be able to build that over time. And the concept of like almost financial investing plays across to our bodies and our health. And I think if you can be consistent over time, the benefits that you gain are going to compound with the more time that you kind of spend actually developing those habits and those kind of, I guess, from a strength training point of view, you're going to keep yourself as healthy and as strong and as robust as you can moving down the track in life. So going back to kind of what we do in the clinic, I think there's a few populations that like we see, particularly with the hip and knee stuff that we do for more of our kind of 50 plus sort of age group. You see a lot of them kind of develop hip pain or restriction or decreased functional capacity, but a lot of them have just sort of dropped off in any real kind of challenging strength regime or any real physical activity regime. And they present with pain and dysfunction as a result or as part of that. And one of the big things that we look at, even with the GP and the clinical guidelines for hip and knee OA, is that you need kind of to lose weight, you need to strength train, and you need to kind of get educated around what's actually happening with your condition. Because if you can kind of take those people and get them strong, what we see clinically and when we take our outcome measures with our hip and knee guys, we see crazy results in the space of 6 weeks. Well, I say crazy, but we see like results that like change dramatically, like 200% change in kind of functional testing. it's just amazing. And then how that correlates to their actual day-to-day life and their quality of life and their function. Do you want to talk a little bit about the hip and knee stuff, what you're seeing? Because I know you're running a lot of that.
Yeah, you're pretty much on the money. Like we run a hip and knee program. As a bit of a background, it's an individualized program where we do a one-on-one assessment to begin with, often with people that have had numerous troubles for long periods of time. They may have seen kind of different practitioners. Often a lot of them have seen specialists as well. Some of them have been offered kind of like hip, knee replacement, different surgeries, and some of them have also had some of those surgeries. So often these issues are fairly ingrained, but what we tend to see and what we usually do, we tend to do a structural assessment to begin with, just to ensure that we're kind of happy with everything from that perspective. If we are, then we want to go, okay, whereabouts is this person currently operating? What's their level? What is their body able to withstand? What causes them pain? And then we look at so kind of where that is, and then what are the things that they want to be doing at this point in time. And often we see this like mismatch or this discrepancy, because sometimes as a result of pain, people tend to do less and less because pain is obviously not a very pleasant experience. So people tend to try to avoid it, which from a strength perspective leads to atrophy of muscles, leads to weakness, leads to kind of like lowered coordination and things like that. So suddenly what you're seeing after longer periods of pain is that kind of discrepancy or mismatch that we're talking about becomes greater and greater. So the tissue and body's ability to withstand it all is down here, but what they're trying to do is up here. So the approach that we take, and sounds pretty simple, but sometimes it's a bit easier said than done. But if we get it right, what we look at doing is building up that capacity. So suddenly you've almost got a little bit left over in between. Then you're able to do all those things that you mentioned before, kind of getting down, playing with the grandkids, getting out and going for walks, playing golf. Suddenly you can do all of those things and you've got a little bit left in the tank and you actually feel good doing it. You enjoy it. You tend to do more. And it can be kind of like life-changing for some of them as well.
100%. I think the mismatch, like the mismatch analogy is just, I think, hits the nail on the head in the sense of like, you have kind of people come in and they might get, let's take the knee, for example. It doesn't have to be an elderly prop. It could be someone with like some anterior knee pain, some like patellofemoral stuff going on. And you kind of look at what they're doing in their day-to-day, and they might have trouble with stairs. And then you go and test them like in a single leg kind of step down or something like that. And they've got no eccentric control. And you kind of then go, well, if we can improve this in clinically in the gym or whatever it is and get them doing it over time, educate them around like why and how it's an important thing to do, you see them start to change in their actual capacity, and then they can actually start to navigate stairs with load and things. But I think you find people get probably a little bit scared, and it all depends on their experience, all depends on what they've been told, their history, what their kind of psychosocial profile is like, and who they've seen as a health, what they've been told in the past. But we're squatting every day. We're doing kind of a deadlift movement to pick stuff off the floor. We're stepping up. We're walking upstairs with groceries. Like our weight training, our strength training that we do is really about being ready and prepared for life. And people often get scared when you kind of give them maybe 4 kilo weights in their hands and you're asking them to do a step up, and they're like, oh, I can't do that. My knees are no good, or my hips no good, whatever it is. But then if you kind of sit down with them and go, well, look at what you're doing every day. You've got 35 stairs at home that you've got to navigate. You've got to carry shopping. You've got to carry baby, whatever you've got to do. You've got to build the body to the demands of life or sport, whatever it is. So like if someone wants to be playing high level cutting sports like AFL, soccer or rugby league, if they're coming off the back of, say, a surgery, their rehabilitation needs to map towards that. And if it doesn't, if it falls short and they're kind of just said, someone's telling them just go and do some glute work, go and do some gym work, and they don't really have a roadmap to, all right, I need to be getting up to plyometrics, I need to be doing change of direction work, I need to be heavy strength training and things, you need that people need that guidance, but they need to navigate that mismatch from like injury or pain or surgery or whatever it is to whatever demand they have in their goals. Is it sport? Is it life? Whatever it is. And our job, I think, is basically just being a Google Maps for people in terms of their life or their sport or whatever they want to kind of get to. We need to figure out what their destination is, where they are, and then we've got to kind of help them navigate to that destination by saying, hey, I think we need to pick up more of this area. We need to be testing, retesting. And often I think you'll see people will kind of have flare-ups, and we kind of need to be pushing people to their limits or to the edge of their capacity so that we can allow adaptation and kind of tissues to improve and tolerate more load. And especially if they want to be doing those higher level things and there is a mismatch. I think I like that mismatch analogy for people. And I think that works well when you actually explain to people, you're like, this is where you want to be on a kind of ladder of progression. This is probably where we are. We just need to make those steps to get there.
Yeah, I think you're 100% right. And it's one of those things, if we can guide people in the right direction, when things say they do have a flare up of things, if we go, oh no, this is fine, we just kind of tinker with things, get them back on track, then over the long term, it's almost like you were talking about before, just getting like that compounding of results. So
exactly,
it's kind of nice when you see that occur, because you do see some people to begin with, and where they're at is their capacity is almost below their ability to withstand just gravity and getting up and down stairs and up and down from chairs, when they do want to be doing things like carrying, shopping, grandkids, or even doing kind of weights at the gym. But at this point in time, that's where their capacity is. And then if we can build that up, and it's sometimes the good and the bad thing about, there's, I suppose, pros and cons of our current medical kind of system, where scanning to find out about pathologies and things like that is so prevalent. It can be good because it gives us a lot more information, but then there's also the downside where sometimes you do get some arthritic change or a few various kind of tissue pathologies or things present on scans that suddenly cop all the blame. So rather than the fact that someone's got a right knee that might be 50% weaker than the other side, their control's significantly reduced, and basically it's just functioning at quite a low level, suddenly all of the emphasis gets put on a little bit of some joint changes, so some arthritic changes, and they get told, because you've got arthritis, that's why this is all occurring. When often we see that, that arthritis might be present, but it's only symptomatic, or the knee's only symptomatic as a whole, because the capacity is so far down in regards to where it needs to be.
So and if you kind of look at, sorry, Greg, if you kind of look at then those other studies that have been done, that like if you look at those asymptomatic people, age match, that might have a scan as well, and they come up with the same sort of pathologies on MRI imaging or whatever it is, they don't necessarily have pain or any kind of symptoms, but they've got similar presentation on MRI. So again, probably something we'll touch on in the future is that the scans aren't kind of definitive for your pain, because if we dive into the pain stuff, we know that pain doesn't mean damage or tissue injury as such, because pain is a multifactorial experience for different, and will present differently in different people. Probably for another
exactly
another couple of hours for the pain science stuff.
100%. We could go down that rabbit hole, but I suppose like you do see that, unfortunately, where scans are really beneficial and we use them kind of a lot in the clinic. But if you just look at the scan independent of the person in front of you, then that's not necessarily kind of your answer. So you need to kind of put them together, find out what's relevant, find out, I suppose, what that means for that particular person. Which sometimes doesn't always happen, where suddenly they've just got a label on things.
Yeah. And I think like if you look at the demands of life, if someone's trying to run, or let's take running as an example, if we're looking at a younger population and they don't have any real quad or knee extension endurance, knee extension power, they don't have the strength in their knee extensors. If they're trying to run and deal with the ground reaction forces that are coming back at them, and let's say they're operating on a knee that's the symptomatic knee, or it's a post-op knee, or whatever it is, and it's sort of significantly down in its testing of its functional testing or its strength testing, then what you're going to find is a knee that's trying to deal with the forces of the ground reaction, like the ground reaction forces as you start to increase your impact load. They're going to see a knee trying to tolerate those loads that just isn't going to do it as well as the other side if the other side's so much better. And you need we kind of have a few baseline measures and tests that we say, okay, you're now ready. We foresee that you're ready to run, but we're going to monitor like your progression and your return to run program, because we need to know if this injured area or this kind of post-op kind of limb is ready to kind of tolerate those forces, and we kind of monitor their response and have a look at kind of how the knee responds. But you need to have a baseline of dealing with life, and we've talked about this a lot, quite a bit. Is that we need to have a baseline for dealing with the demands of life. And I think you mentioned last week the get up kind of assessment, or even something as simple in our elderly population as the ability to stand from a chair, really predicts independence. Because if you can't sit to stand and get up independently, then you need to depend on someone for getting out of a chair, getting out off the toilet, then likely getting out of bed and things like that. So you, on a real end stage with the elderly pops, what you find when we go back into the hospital stuff is, can they sit to stand independently? Can they navigate stairs independently? Are they independent in their bed mobility? Can they transfer independently? And if they're not ready to be discharged home if they don't have the care or support. So you've kind of got, if we bring it back down to kind of just the 12 to 40 years old strength training kind of study that we're looking at here, is that we need to have a baseline of strength. And if we've got a baseline of strength, you can really decrease your injury risk, which is, especially in our sports pop and our people that are playing soccer or netball on the weekend. If you're not strength training during the week to some capacity, you're more likely to be injured. But if you start, you can drop it by 2/3 or whatever the study's sort of suggesting, 2/3 in terms of your injuries. It's for a return on your investment, it's huge. Kind of when you take into account the psychological factors, the financial factors, the time off work, whatever it is that a major injury has on a person, the return on your investment for probably 2 half an hour to 40-minute strength training sessions per week is huge. So I think one of our tasks, and what we kind of said before, is that we need to really be health promoters. And this is what kind of this is all about, is getting kind of evidence and information, education out there that, hey, how are we going to how are we going to help you better yourself?
Yep, definitely. And I think that's pretty well said, because sometimes injury prevention isn't kind of like the thing that people think about. Everyone's like, it's not going to happen to me until it does. So I suppose the big part of a lot of this as well, from like a sports side of things, is most of it's performance enhancement. So where we spoke before about capacity, it's almost the same, but how it applies to sport. So often the intention of these programs is performance enhancement, which subsequently reduces the chance of your injury risk. So it's kind of like a two-pronged sword. And like you were saying about the kind of 2 sessions per week, the research has shown that you don't have to be kind of pushing weights every single day to have an effect. It's actually kind of 2 sessions a week is kind of like a nice dosage that's shown time and time again to have those results. And then we do know there's a lot of people out there who going to the gym isn't necessarily their thing. There's plenty of things that you can be doing at home from a body weight perspective. It doesn't necessarily have to be, I suppose, that going to the gym, that like bodybuilding approach that kind of gives you the results. Often it's kind of body weight exercises, functional movements, things along those lines that give you the greatest benefits to it. So you can,
you can change the demand on the tissues, or you can have the strength training effect by just changing the variables like tempo, having a look at how much kind of body weight you're actually moving as well. I saw a study or something. Saw something posted in one of the EP groups that I'm in. It was about the body weight percentages in terms of the push up, and the higher the feet go, the increase. So they estimated around 60% of body weight in normal push up, and then I think it was up to about a 60 centimeter box with the feet elevated, got you to about 85% of your body weight. So I mean, for me, who's pushing kind of 92 to 95 kilos, depending on the time of year, like you're moving some significant weight. And I can't remember I can't remember the last time. I've used more kind of body weight stuff than getting under the bench and things at the moment. But there's ways to. I think the moral of the story is, and I think we've talked about a lot, is you don't need a huge amount of equipment. Like you can structure your programming based on what you've got available to you, and you've got nothing available to you, then how can we challenge you, and how can we progressively overload you by simply changing the variables of tempo, changing the variables of kind of how you're setting up a double leg versus single leg, slowing tempo down, getting more time under tension. We can actually induce a strength training effect just by playing around with those variables. You don't necessarily need to have access to a gym, although it'd be good if you can. But yeah, people can get some strength training done no matter where they are. It really comes down to how you do it.
That's it. Often just like, it's not as, it doesn't sound as high tech, but just like simplicity, minimalism, like if you just do things consistently, do things that are challenging and they can be body weight exercises, then you're going to get basically all the effects of someone who does have a gym available to them. Obviously, there's different things that you'll be doing, but if you kind of structure it the right way, do it well and do it often, then pretty good benefits are shown.
So I know you've got someone in a couple of minutes. So one thing from last week, I kind of rewatched our thing. I was like, all right, we should have probably concluded, recapped a little bit better. And I posted that push up, that swipe through last week. And I kind of think what we'll do for most of these sessions is just have our takeaways at the end. So what are our takeaways for this Flow Nose number 2 strength training, Craig?
So a couple of things. Get out there, do some strength training, particularly with COVID situation and sport off for the time being. It's probably a nice chance to focus on it. Consistency is key. And then it's also been shown to be really safe. So in the study that we spoke about before with over 700 participants, there was basically no adverse effects throughout the program. So don't be concerned that you're going to kind of damage things or injure something. If it's implemented in the right way, then that shouldn't necessarily be a concern.
Get some advice if you have no idea on technique and how to program and things like that. But generally a safe kind of modality to try. But if you're a complete kind of new to the situation, then just kind of get your advice before you start, I'd imagine.
Yeah, definitely. That's it.
Anything else there?
They're the main things, I think. And sometimes we do see a bit of like paralysis by analysis where kind of thinking about it, what am I going to do? How am I going to do it? And then it kind of falls off the back of the bandwagon and it's just gone. So the biggest thing is, I suppose, now is as good a time to start as ever. So get out there. Don't expect to be kind of Arnold Schwarzenegger day one. Just work on creating the habits initially, build into it. It's not about feeling like as sore as you possibly can or anything like that. It's more about being smart over time and just consistent over time.
I guess we can talk about kind of the strength training principles and how to approach it in another one. The big things from my end as well, just to recap on your stuff, is compound your health. So strength training forms part of that. And we know from the activity guidelines, again, that across the board, we bar any kind of like medical contraindication, people should be strength training as part of their kind of healthy lifestyle. Twice a week is suggested. Depending on how you split and what your goals are, will change that. I think we just can get consistent, strength train. It'll help to compound and have a better, get your health improved. And then, that's it. I can't remember where I was going with that.
I think that's a pretty good way to end it.
All
Compound your
right,
health.
I'll let you go. I looked at my watch again. I did it last week in the video. I don't have
The
it on.
invisible
So
watch.
it's 10 past. All right, mate. I'll catch you soon. Flo's
Sounds
nose,
good.
number 2.
See you guys.
Thanks, Craig. All right. Done.
Cool. Perfect.